Foundation. We're a charity run by disabled people for disabled people.
We chose a VCSE partner, so we chose Vicky to be on our steering group for organising the testing, and then we picked 2 particular groups to do the work with. So the first was our research engagement network, whose purpose is to increase diversity in research, so we thought we'd get a good cross-section of people there. And then our second group was our Working with People and Communities Advisory group, who worked with us on all of our kind of like people and community strategy type work, and we thought we'd try it out with both of them and then do a comparison.
The beauty of both of those groups was that they brought together a range of partners, including individuals with lived experience. So we were getting really diverse perspectives as we were testing the framework and getting really useful feedback about things like bits of it that might have initially felt a bit complex, that then we could feed back to the development team so that they could tweak them.
We had a think about recent engagement work that we'd done. So one was around speech language communication needs for young people, and the other one was around the development of a website called Not Alone. We did some previous engagement work in relation to that, and we used the framework to look at the work that we've done and how that can be then done around the you said we did and the so what, and the evidence and the impact that it can have on those specific communities.
We felt that having the engagement framework would be really useful in ensuring that a systematic and consistent approach is taken across the ICS, and that engagement is everybody's business, not just the sole responsibility of one engagement and experience team.
Yeah, community involvement is engagement, and engagement is community involvement. So you can't really have one without the other. So having a focus on doing it right is kind of doing the whole thing right. And I think part of this framework is how do we get this aspect, tackling health inequalities, how do we get that aspect of engaging with people right?
The ICS is a very complex system. We're working with a lot of different partners, stakeholders, and again, because you've got this framework, it offers you a standardised process and something to work towards, rather than often when you're trying to come together and collaborate. At the start of that project, you might be trying to work out, well, what do we need to do? How do we do it? But actually, you've got that in this framework. It's kind of, no, let's just use this as our guide.
The different elements of the framework, we thought they were very, very dynamic. It felt like every step of the way there was something positive to hold on to. Yes, it's great to move into the next one, but actually, if you've done the first bit well, that's a win.
The CQC and their partners were really receptive to feedback. I think really keen to get it right. So we did see changes as a result of feedback that we gave, which was great.
I think the framework very much works in parallel with the work that the engagement team already does, but I think it is useful to think about how we might use it more within the work I'm involved in with co-production, to have a kind of a standardised process, because it gives you those standard questions to test yourself and assure yourself against, to see where we are and how we can improve and what more we could do that perhaps we haven't thought about.
The insight from the integrated care systems that piloted the framework for us was crucial to ensuring that the framework that we as an expert advisory group and as a partnership had developed, because we needed to be sure that it worked in real life situations. So their insight and their use of the framework through the piloting phase meant that we were able to kind of adapt the framework as it was going through the testing phase, and then afterwards based on their feedback and their experiences in using it, in order to make sure that it is as functional and easy to use as possible.
What I've learned is that through working with National Voices, the Point of Care Foundation and the Care Quality Commission, they did what they said they were going to do. They gave us a chance to test this. They changed it in response to what we told them. I really like the look of it now. I'm really excited to go out there and use it in the next year.
I think using the framework can really help build trust with partners. So it's about sharing the power and saying one party doesn't have all the answers. So for example, the ICS, we're saying, look, we need to work together to get this right, which is so important, and we need to reflect and be open about what's worked, what hasn't worked, so we can learn.
It's really important to have a wide range of stakeholders involved in testing something like this framework. I think as health professionals working in the system, we can easily get lost in our own silos and think about how things might apply to us and the work that we're doing, and then neglect to think about how applicable things are to other organisations who work very differently.
I think it's more important not just for us as engagement, co-production, personalised care team members. I think it's more important around how commissioners can use that framework to evidence the engagement work, but also how we address those health inequalities for those underserved communities.